Well, good morning, humanity. It's June 20th, 2022. A lot of twos there. And it's our favorite time of the week because it's Mondays with Bev and Paul. And hi, everybody. My name's Paul.
Good morning. This is Bev.
Good morning. Good morning to you, Bev. Good
Thank
morning.
you,
Good
Paul.
morning.
You too.
And good morning to all of you today. We have a great show today because we got blitzed out at what was called the Arizona Sonshine Medical Care Event up in Prescott Valley. And it was so awesome. Let me show you the little thing. This is what we went to. It was their seventh annual one. It's a free healthcare clinic, ran 2 days, and they have dental care, eye care, health coaching, diabetes education, naturopathic medication, immunizations. They've given vaccination. They have doctors there, all kinds. They even had childcare, and this crew right here went up. There we are, and it's a perfect picture. Arizona Sunshine. You got Ann, Michelle. There's Paul. There's Bev and Eileen. We drove up there, spent a couple of nights, and we touched a lot of people, didn't we?
I think with what you said, we were blissed out. Yeah.
It
What
was
an honor to be there.
it
Oh
was
my.
it was incredible. So
Yeah.
let me show the here's the booth we had. There it is right there. We had a little booth, and the five of us would meet people. We would share BioTouch, and I just have to tell you, we were part of the event. We were totally, what did we use the word, embraced by the medical profession, the religious group, because this is put on by the Seventh day Adventists.
Yep.
Um, and it was incredible. Right from the beginning, I actually presented at the orientation for the volunteers. They had me come
Right.
up, and right from the beginning, we're talking BioTouch. And,
Yep.
and what did we find out? Everybody knew us.
I know. And I went away with going, the BioTouch, we were embraced and accepted by both of these communities. By the time we left, it was like I somebody said to me, you are the darlings of this event. you
Oh, wow.
are you are the like these this amazing gift that came here. We are so grateful for you. Oh my gosh, there's a lot. There were some tears, there were some hearts open and oh my gosh, the joy. Oh,
Right. And one of the reasons we went, well, not one of the reason we went was because we got a chance to hook up with Dr. Kenna Stephenson. There she is with
yeah.
Ann and Michelle and Bev, and here she is with me. I mean, she and I, it's been over 20 years since we met, since we talked actually, and she did the
Right.
research with us, and she's the one that really pushed to get us there. And now we've got to tell you that what did you call her? The midwife for BioTouch's time has come in
Yes.
now. How did you put that?
Yes.
What was it that came to you about that?
Well, it came to me that on Thursday, July 16th, there was a birthing that took place. This mother called IFBM, a birthing took place.
Hmm,
And this divine child called BioTouch was birthed, and Kenna was the midwife.
interesting.
That's exactly what came to me.
Eileen was just saying, yeah, we touched over 200 people, and Kenna's the one that brought us there, and
Yep.
she uh, how do we put this? Let's go over some of the things that happened. One of the main ones was this whole blood pressure situation.
Oh my
Yeah.
gosh.
What was it that you kept hearing about that?
Oh, yeah. Well, we kept having people from triage come over. Can you come over with us? And then we'd have the patients themselves. I've been sent over here because my blood pressure is too high. I can't get screening and move forward until my blood pressure comes down. Or the doctors would send them over. Or that, it was just, I heard Kenna say next door to us, to this young man, okay, I want you to walk next door and I want you to take a seat. I want you to have some BioTouch. And you know what impressed me with that? A doctor told him to do that. He never questioned it.
Yes.
He just walked in, took a seat, and waited for one of us to go and do BioTouch with him.
Yeah.
It was really kind of yikes.
And so what did we find out? We found out that people, some of the medical professionals came over and the volunteers said, "Oh my gosh, we just have to tell you, there were at least three that weren't able to get screenings, and when they were done with their BioTouch, their blood pressure had normalized where they could do the full screening."
Oh,
And
yeah,
people were coming up to us saying, "This is incredible. We just need to thank you for being here and doing this with us."
absolutely.
And
I know.
and so the term BioTouch, that's the other interesting thing. People knew us by our name. It wasn't, oh, go do that touchy thing, this thing
Right.
over there, go, this feely good kind of thing. The volunteers would walk the participants past our booth to go to these other things, and they would say, "And you need to come back here and get BioTouch." It
Oh,
was
yeah, it was
always,
word of mouth, people sending people over
yeah, and
to
BioTouch was the
experience it.
word. It wasn't,
Right.
and then as with Kenna, she put it in the chart, the medical chart, had them get BioTouch.
I know. That's
So
what I was saying. It was crazy.
yeah,
Crazy good.
and so even the head pastor came over and thanked us.
Yeah, he it was funny because Ann and I were sitting in our booth early Friday morning waiting for people to come in, and this guy, he started to walk by and then he looked at the poster and he backed up and he looked at us and he's like, "I got to tell you guys something. I've been hearing incredible miracle stories about people whose blood pressure have been going down and people who have just been feeling," and he ends up going, "I'm a believer." And we find out he's the pastor, the main pastor, minister of the Seventh-day Adventist church that is, working with the Sunshine Association. So it was pretty cool.
Yeah.
Very cool.
And then we actually had the head of the what is it called? County Health Department was there, and he came over. Yavapai County came over and thanked us for being there.
Right.
And then we had the guy who's in charge
I know.
of the next Arizona Sonshine event in Lake Havasu City, and he just said, "I really want you to come. Can you come? How much? Is it about the money? We'll help pay for you to get there." And Kenna said, "If you don't go, I'm not going."
Exactly. That's what she told him.
Right.
If they don't go, I don't go.
Right. So the pressure is on, folks, for us to do this circuit. And then that's in September. And in November or December, they're doing it in Casa Grande.
Casa Grande.
And I think it truly is a new birthing, a new phase for this organization to really be of service to humanity.
Right.
And stand next to, whether it's a religious organization or the medical organization, that BioTouch bridges this whole situation.
Right. And, we've always said that BioTouch works and enhances everything. And we mean as in these social communities the medical community, the religious community, it breaks down all the barriers. It's part of humanity's, it's vital, it's important, it's worthwhile for humanity to be introduced to this great gift that this foundation has been holding and will continue to hold for them. And now we're seeing the truth of that, how quickly and how fully we were embraced and accepted.
Right.
Yeah, I'm a believer, this guy says, with his two fingers being held up. I'm a believer.
So tell them about the experience with the woman that just sort of passed out on the chair.
Oh, dear gosh. Oh, my God. Can I just say that it wasn't just me that was a little bit.
Oh, yeah.
All of us were like, what in the world? Yeah, this lovely woman came and said, "I've been hearing about BioTouch. I want some." I said, "Sit down." Well, did the greeting, that greeting that we're always teaching. I did the greeting. She was fine. Oh, took a breath into the body, did the A&A of the headset, which we're always talking about. At that point, she closed her eyes. I did point number 1 on the head. her head just started shifting. By the point 2, her head was laying on her shoulder. By point 3, her head was all the way back, and I thought, she's gone comatose on me. I said, hello, excuse me, nothing. I looked at Ann, and Ann's eyes I'm like, I just kept touching. I looked at Michelle, and Michelle's like, what the heck? So here's Eileen, the pharmacist. She walks over to the next booth, the nurse practitioner that was doing the diabetes information and she says, could you like step into the next booth? Something's going on. So she comes over and she says, what is she doing on her? She's just touching very lightly on the head. Well, then the daughter walks up. What are you doing to my mom? What? By that time, I'm thinking, oh, good Lord. But I knew that BioTouch does no harm.
Right.
And remind me, we need to say what Kenna told us about what happened to her. Anyway, I finished the headset, and we all I just like shook her a little bit, and her eyes flew open, and she sat up and she looked at me, and she said, what in the world did you do to me? I have never been so relaxed and happy and at peace.
Wow.
I said, well, I just did BioTouch. And she said, girl, I'm telling everybody here about BioTouch. And her daughter's like looking at her like, oh my gosh. Well, what Kenna said to us was, when you are in a state of such stress, physically, emotionally, mentally, whatever's going on, and you get that light touch on the body that tells the body how much you're loved and how much you're cared for, you go almost unconscious. It's such an incredible drop from this tension down to this thing that, yes, it happens. She
called it an altered state of consciousness, like a waking dream.
Yes, it's so amazing. And this woman just could not say enough. Right. Good gosh, what happened to me? Oh, she said, praise the Lord. I think I went to heaven.
Yeah. And that was from people all over. I mean, people would say, can I take you home?
Yes, I love you.
Yeah. Oh, I just love you.
I love you.
There was that lady with a shoulder problem. She got worked on. Her shoulder pain went away. She came back a few hours later. Oh, I'm still feeling great. And then hours even after that, she says, oh, I just need to let you know, I feel great.
Yeah. How about the woman that I did that she had that back thing where she had that back surgery, and I leaned her forward and I was able to do a little bit of work on her back. And she said immediately, oh my God, I love you. I love BioTouch. This is the first time in 5 years. You were working on her husband at the time. Remember?
Oh, interesting.
He was sitting out there and we were working. She said, I am pain-free in this moment for the first time in 5 years. Incredible. I have no pain.
And what's interesting is this all bears out with what Kenna found with the research.
Right.
And these things are happening in the midst of this huge arena.
Huge event.
With tons, there's hundreds of people walking around. There's music over here in the corner. There's music. Right. This is not some, you're sitting, like we always say, there's no whale music, no tinkling cymbals, it's not
no preparation.
Yeah, it's not, you just sit down, lift up your shirt. There's 5 people in this little 10 by 10 booth. You're bumping into each other.
Exactly.
And people are, this one lady, she goes, oh my God, that was the best meditation I have ever
I heard her say that.
And I said to her, and I went, well, yeah, and you didn't have to think about it, because most meditation is, oh, you think about it. It just immediately within 5 minutes, and that's all we're talking. We're talking about 3 to 5 minutes, 5 minutes on the average with these people. 5 minutes in a very chaotic situation, and people were having these kinds of
no intention.
No, and they also gave us a booth, a private booth, where people were able to go and have. They could remove their shirt or blouse and get the whole back set and things like that.
Yes. Yeah, Eileen became our take them into a private room girl. She was
Right.
doing a lot of that, which was amazing for us to be able to offer these people a little bit more in the moment. Oh,
Yeah, and so let's see some of the other thing. I got a list of them. Oh, that triage lady comes over. She comes over. She says, "We need BioTouch." Again, they said the name. You know, it wasn't
right.
"We need you." We need BioTouch. A woman was having an outrageous migraine
Migraine.
headache, and so one of us went over,
Yeah,
started
she
doing it.
literally grabbed Anne's arm
Right.
and Annie's like, let me get some stuff on my hands.
Yeah, and immediately the pain was lessened where she could go on and do more work. Go on to whatever the patient was looking to do. And then there
Right.
was that one volunteer kid that was over in one of the other booths, and he was having an outrageous allergy infection situation
Yeah,
with his
I
sinus.
worked with the woman that brought him there.
Yeah, and
And she
he's
was telling me what happened.
yeah, they needed to go get medication. They were getting
She
ready.
was just about ready to go to the store and get him some nasal spray. He was in such misery. And somehow he made his way over to our booth and told whoever worked with him, I'm sure she did the sinus and that allergy point and whatever. And by the time he got back over there to report to her, he was over it. And that's why she came over, because she was having something. And I worked with her, did BioTouch with her. And she was telling me that story of this kid that she brought with her. Yeah.
It was one story after another. I mean, at the end of this, we only did a day and a half. We were exhausted because, as
We
Eileen was
were.
saying, one of her things was, I feel I'm tired, but I'm energized. I'm
Yeah.
relaxed, and she's so stoked. Well, we all got
Right.
so stoked, and the energy was so high that you just sort of crashed the next
Oh
day.
man, that's right. The minute we got home and
Uh,
everything,
So,
yeah,
it's time. The organization, it's time to get out there. We're really going to move into putting out some information, and we're asking everybody out there to help support the organization. To go to all these places, we're going to need funds to do that so that we can offer to these communities. I taught this one family who all they have is catastrophic health care. They can't really afford standard medical
I
care, so they're
know. A
looking
lot of
for
them were
they're
there.
looking for
Mhm.
other opportunities in healthcare. I was able to teach her and her kids right away, and they were noticing results. And Kenna, Dr. Stevenson, is ready for the next research project. All these things, are going to cost some
She
money
is
to
so
do.
passionate about
She loves
BioTouch.
BioTouch. She
I know
just
it.
feels it's just the way. It's the bridge between both the alternative complementary community and the standard allopathic
Right.
community. BioTouch is really the powerhouse of healthcare right now. And
It
so
is.
she wants to do a new research project that we are actually going to be able to do on a global scale. We're looking at a couple of things, but we have practitioners around the world.
We
Imagine
do.
being able to bring the data together from around the world about the effects of BioTouch. And if
Yep.
anybody can do that, Kenna Stevens can do that, along with, she hooked up with Eileen, our pharmacist, who knows how to put things together. And I think we are on a roll
We
here.
are on our way.
Yep.
Yep.
So we're here to help you. We can't tell you enough. I mean, we have one testimonial after the other.
No.
Give us your testimonial. Send it in. How has BioTouch helped you? Put it in a comment, send us an email so we can share it with other people. Again, go to justtouch.com if this is the first time you're hearing about this. And you can download the first 10 pages of the manual for free. We had half of those people that we worked on put their name on an email list, and we sent them the first 10 pages because we'd showed them how to do it. And half of them have already opened it a day later. So
I know.
it's time. One lady talked about she can't do massage because it's too hard on her, and she loved BioTouch and had more than the same results she got from massage.
Right.
And wants her children who are massage therapists to learn
Yeah.
how to do it. Yeah.
Her kids have a massage center
Yeah.
in Prescott.
So we are looking to pass this on. They can get CE credits, nurses can get CE credits, but if you don't need credits, you just need the credit of learning how to do this for you and your family. Oh my
You
God.
know, I was thinking about something, because we always say that you don't need to prepare a space, but we do have one thing that just came to me. That greeting prepares the body for love, to open it up to its own inherent loving presence within us. That's what we call self-awareness.
Yeah.
So we do have one step of preparation. It's called the greeting.
Take those two fingers,
Get
reach
ready
out,
to be loved, body.
let yourself be loved, get ready to
Yep.
be loved, and thank you for letting us love you.
Yes.
We'll see you all next week. Thanks.
Have a great week.